there everybody, my name is Kat Bowser. I'm your resident fantasy therapist and welcome to my channel. Those of you here for the very first time, welcome. My name is Kat Bowser. I'm a licensed therapist. I'm also a writer working on my first two novels, one a standalone, one the start of a series. And on my channel I like to talk about what I consider to be the heart of writing, and that's the characters. And the heart of the characters can be found in their psychology. So that's the angle I like to take with everything I talk about on my channel pretty much. So today I am continuing my series of videos about disorders, issues, mental health problems for the month of May. So last time we talked about bipolar disorder, and today I wanted to talk about a disorder that pops up a lot, particularly because we writers like to be particularly mean to our characters. And I think it's kind of fitting because where I'm from, the United States, Monday is Memorial Day. So let's talk about PTSD. Okay, so PTSD is short for post-traumatic stress disorder, and it is probably one of the most well-known disorders out there, but it's more nuanced than most of the time it is presented as. One of my big issues with how it is presented is usually not that it's necessarily presented inaccurately, but it's not presented. You're seeing some of the truth, not the whole truth. I'll put it that way. I have seen it done blatantly, obviously without someone having done any research. But most of the time, it looks like people have at least attempted to do some research. So there's that. So kind of like what I did with bipolar, I want to talk a little bit about the history of it first, and then I'll go into specific things people do right, things people do wrong. So basically, PTSD has been around as long as humans have been trying to kill each other. You can find it throughout history. The earliest instance I found was, again, in ancient Greece. Ancient Greeks kept good records that we are still finding. First instance that we have found is the story of the Battle of Marathon by Herodotus. Again, I'm not good at Greek names, so I'm apologizing right now. Which was in the 5th century of ancient Greece. Hippocrates also made note of people that he treated that had flashbacks and battle dreams and things like that. It's referenced in several different poems and things like that, from like 4607 to 377, 50 BC. It's all over that place. You can also find it. Shakespeare references it a couple of times in some of his plays, sometimes metaphorically, sometimes more directly the characters. Like I know in Romeo and Juliet, it's mentioned as Queen Mab gives men dreams of death to awaken them and things of that nature. So there are accounts of soldiers having reactions to battle during the 100 Years' War. And then we get into about the 1800s, and we start to see, again, references to this behavior either on the battlefield or when they return home. During the Civil War, it had, in the United States, it had a couple different names. One of them was railroad spine, in reference to the exaggerated startle reflex. The other was soldier's heart, which was used to refer to people that came back from war changed and kind of hardened. After that, you get into the more common terms that we know of, battle exhaustion, battle fatigue. Early 1900s, we got shell shock from World War I. And there was also a term, the 1,000-yard stare. There is a very famous photograph of a soldier who is experiencing PTSD on the battlefield, experiencing a symptom of it. And he has this very disassociated look to his face. And that was actually a term that was used quite often, was 1,000-yard stare. So this kind of continued onward to World War II, Vietnam War, that kind of thing. And In the 70s, there was more of a push of this does not only apply to people that have come from war. There are other circumstances that can contribute to these same symptoms. So 1974, psychologist Anne Wolbert Burgess and sociologist Linda Lytle Holmstrom coined the term rape trauma syndrome to refer to PTSD symptoms that women experienced after surviving a sexual assault. And then about the 80s is when we get the term PTSD, which has pretty much stuck since then. PTSD is your body's reaction to severe trauma. Trauma can come in many different forms, and this is something I want to emphasize. I cannot emphasize this enough. Trauma, the only person that needs to think that what they went through was traumatic is the person it happened to. You're going to get a wide variety of people that develop PTSD symptoms, and it's not always going to be from a battle. It's not always going to be from abuse. It could be from various different things. It could be from a car wreck. It could be from witnessing a car wreck, because everybody's psychology is different. So one of the things I really want to point out is there is a movement out there saying essentially you haven't experienced enough trauma to have PTSD. Not true. So I'm just gonna put that out there. The only person that needs to say that this was traumatic is the person it happened to. Full stop. So that being said, what does PTSD look like? PTSD is actually one of those extremely varied disorders. So what I'm going to give you guys is the basic symptoms that we usually see. It does not mean that everybody will get them. It does not mean that you will have all of them. You may just have a few of them. So PTSD is usually characterized by someone who has either been in a life-threatening situation or observed someone they love be in a life-threatening situation. And so essentially they were either in fear of their own life or in fear of someone very close to them's life. And what generally happens is you have someone now who has what we call an exaggerated startle reflex, which is where you jump when you're surprised. And it's a survival mechanism. But someone that has PTSD is going to jump much easier and have a much more vivid reaction than someone that does not. There is irritability, anger, trying to avoid situations that remind you of the trauma, which we call triggers, whether it be a place, a smell, a person, a date, anything like that. There are what we call invasive dreams, which are basically very intense nightmares that don't allow you to sleep, and they kind of follow you when you wake up, so they stick with you when you wake up. Flashbacks. And I want to talk a little bit on flashbacks here. I think this is the one symptom that I think everybody uses with PTSD, because kind of like with bipolar and the mania, it's trademark symptom. Not everybody gets flashbacks. In fact, most people don't. So a flashback is where the person's sense of place and time is disoriented and they feel like they're back in the situation, back in the traumatic situation. It does not necessarily mean that it's going to be a mirror image of what that situation was. Most of the time, it's more of an emotional representation of that trauma. So if someone was injured on a battlefield, they may not be exactly back on that same battlefield, but they may be having the feeling that someone is firing at them, that kind of thing. So they literally see, they hear, they smell. It's like they're back there. So it's a form of disassociation. And disassociation is that feeling of you're no longer in your own body. You're kind of disconnected from it. I've had people describe it to me as kind of like you're looking down on yourself. You could kind of see yourself, but you're not quite there. And And again, it's one of those things that's very different from person to person to person. But that is a symptom. Flashbacks are a symptom. The main important symptom of PTSD is that all these symptoms that I'm listing, the fear, the anxiety, the dreams, the dissociation, the flashbacks, these are all negatively impacting your life. And that's the main important thing is there are people that come back from trauma and they have some of these symptoms, but they're either not negatively impacting their life or they pass quickly or things like that. So you may have a character that has what we call acute stress disorder. And what that is it's a disorder that's almost exactly like PTSD, but it only lasts a month or less. And sometimes you don't even need therapy to honestly pass through it. You just kind of process it yourself and then the symptoms disappear. So that's one thing I think to keep in mind if you're writing PTSD is bear in mind PTSD lasts a while. It's what we consider chronic. So even if someone has made great progress in managing their PTSD, they've learned to manage their symptoms, they've learned to cope and kind of be able to function and improve their sense of well-being, we don't consider the PTSD gone. In my practice, we list it as PTSD in remission because the symptoms are not actively disturbing their life, but they could come back. So that's how we list it. The other thing is there is delayed onset PTSD. There is a case where, like, say someone has a traumatic experience and they don't start getting PTSD symptoms till sometimes months later, maybe up to a year later. It's usually triggered, the symptoms usually start happening by some kind of trigger, maybe an anniversary or meeting up with someone that you were with on the battlefield, that kind of thing. So there's that information for you guys. So the main thing that I think people get wrong when they're doing PTSD, when they're talking about PTSD, is they talk about the person having, the flashbacks, the dreams, that kind of thing. But they don't mention the irritability, the anger, the difficulty adjusting back to normal life. And that's a very important part of it. Because honestly, people that are trying to cope with trauma, they're trying to process through trauma, they're not always the nicest people in the world. And that's not a slam against them. That's just straight up the process of dealing with trauma. It's not easy. It's not fun. It's hard work. These people are going to be emotionally exhausted. A lot of times when people come through therapy sessions to cope with and process through their trauma, they leave therapy exhausted. Even though what they've been doing, they've been talking and working through feelings, emotions, that kind of thing. But it's exhausting. It takes energy. And all too often I see it's almost like someone is normal, but then they have dreams and they have flashbacks. But that's not quite how it works. If you want to talk about someone who is maybe near, not what I would call the end of PTSD, because like I said, it's chronic, but at a point where they're pretty well adjusted, they've dealt with it, then yeah, you could have them maybe have a disturbing dream here or there, but you should still show the emotions, the anxiety that causes, because that doesn't go away. What people learn how to do is how to anticipate it coming, how to process it when it comes, and then how to move on and push through it so they can function. Like I said, it's chronic. It doesn't usually go away entirely. That's not to say people don't heal from it. They do. They get better. They learn to process and they learn to cope with it and that kind of thing. But at the present moment, we don't have a cure for it. We do have trials in place of different types of medications that can help people that with the anxiety, with the flashbacks, with the mood fluctuation, that kind of thing. We do have that, and people do take medication like anxiety meds, mood stabilizers, that kind of thing to help them with this. But we don't have a cure per se, at least not yet. let's see here. What's the other thing I wanted to talk about this disorder? Because this disorder gets used a lot. Because, like I said, writers, we mean people. We like to put our characters through horrible things. So I think with this disorder, you definitely need to do your research, and if you can, talk to someone who has it. I really can't stress that enough. Talk to someone who has it, because you can do all the research in the world, read up everything you can on it. But until you actually sit down with someone and actually hear their story, hear what they go through, what they feel, you're not really going to completely grasp it. Because really what PTSD is, it's a survival technique on overload. So a lot of times what happens when we're in a traumatic experience, our brain shifts to survival mode. It wants to know, okay, what do I need to do to get out of this situation so that I can get home, I can stay safe. And when that happens, your brain's priorities completely shift. So now, normally, I'll use this example. Normally, if we were to see like a stick on the ground, our mind's first thought is it's a stick. If we're in a traumatic situation, a dangerous situation, our mind shifts to protect us. And so now its first thought is that's a snake, that's danger. So you're more in tune to danger. And that's why people with PTSD have this exaggerated startle effect, because their brain is still trying to protect them, because in a sense their brain doesn't realize the trauma has stopped. In their mind, it's still stuck on, we need to be in adrenaline mode, we need to be in survival mode. So actually one of the things that therapy is doing is we're trying to get the brain to realize the trauma has stopped. So that's why people are doing processing, to try to get that switch to flip in the brain, like, okay, the trauma's over, it's done. So that's why it usually takes a while, because especially if your brain has been in survival mode for a long time, it's very hard to get it out of that mode. So the other thing that I didn't mention, because this is one of those disorders, no matter how long I talk here, I know I'm going to leave something out, but I'm trying to cover as much as I can. You are going to see physical issues with PTSD. You're going to see physical ailments with this disorder. You're going to see headaches, backaches, stomach aches, ulcers. You're going to see substance abuse usually, because people are usually trying to numb this pain so that they can move on with their life. So that adds another layer to what your character may be having to deal with. And I think those are the basics. Like I said, this is not an all-encompassing video. This is just meant to give you guys the bare bones basics so that you at least have a starting point with your research. I will throw out this. If you guys need a book to really show you how someone processing through this looks like, Alone in the Light by Benjamin Bass. It is a fictional story, but it is based on a lot of the author's own experiences with PTSD. And I'll admit, research papers and stuff, they're not always the most interesting to read. Even though I personally find them interesting, I can totally see why some people wouldn't. This is a really good way to get all these symptoms and stuff that I'm talking about and kind of put them in a perspective in your head. So I highly recommend that book. I have included the link to it below. Definitely check it out. So that being said, I think that is the basics for PTSD that I wanted to talk about. Like I said, with everything else I'm talking about this month, if you can, talk to someone that has it, talk to someone that works with people that have it, do your own research, read peer-reviewed articles, read stories, read accounts, that kind of thing. Like I said, this is very well documented through history. Look up some stuff from history. I looked up a soldier's story from the Civil War, when they called it Soldier's Heart. And it's very interesting to read these letters, because you can see these soldiers' letters from before he went to war, during, and after, and you can see this shift in cognition. So definitely do that. I do think this is a very important topic, because people, unfortunately, there isn't as much support for people with PTSD as there should be. Mainly on the end of, it is an emotionally exhausting disorder. these people are told, you know, you need to keep up fighting, you need to keep up fighting, you need to keep working. And while that's true, these people are exhausted. They need some more support to help them. So that's what I would like stories to kind of put out there, that this is not an easy disorder. It's not just a disorder where you have flashbacks and dreams. It's much more nuanced than that. So let's get some of that information out there. So thank you guys for chiming in for my video. I hope you found it interesting, and I hope it's helpful to you in some way. As always, if you have comments or suggestions, leave them below, and I will get to them as soon as I can. If you guys want to know whenever I upload a new video, make sure you subscribe so you don't miss it. I try to upload every Friday, every Sunday, with some occasional extra videos in there if I can. So until next time, I hope you guys take care, and hope you have a good one.